This segment of Delmarva Life is brought to you by Thomas Podiatry and Associates, giving you a foot to stand on.
Sore, achy feet can really ruin your day, and with hundreds of bones and several muscles and nerves, the cause of the pain could be a number of things.
Yeah, and one of those is called Mortons Neuroma. Now, it may sound like a serious problem, but the fix, it's simple. I stopped by Thomas Podiatry and Associates in Salisbury to learn more.
It might feel like you have a pebble in your shoe, or a fold in your sock, or perhaps a sharp burning pain in the ball of your foot, even numbness. These are all symptoms of Mortons Neuroma.
Some people describe the neuroma pain as a clicking pain.
It's something Dr. Sue Kim sees all the time.
So neuroma is swelling of the soft tissue around the nerve that's running in between these metatarsal bones, going all the way down to the level of the toes.
Dr. Kim says neuroma most frequently occurs between the third and fourth toes.
Most common thing that people get the neuroma from is tight-fitting shoes, also walking on barefoot.
Dr. Kim says the structure of the foot can also cause Mortons Neuroma.
The metatarsal bones might be too close to each other, and they can also cause the swelling of the soft tissue.
Not knowing what is causing the pain, Dr. Kim says some patients try to adapt to it.
Changing shoe gears, trying stretching at home, but nothing seems to help. So there are some cases that patients just go on without getting any treatment. Neuroma usually happens right around here.
But Dr. Kim says treatment is pretty simple.
First thing is a shoe gear changes, wider toe box, with a better support on the arch area and the sole of the foot in general.
A tight toe box in the shoe means the toes are scrunched together. Dr. Kim says sometimes going up a shoe size can take care of that. Stretching the toes is another way to get relief, as is what's referred to as RICE, which stands for
resting, icing, compression, elevation.
If none of that works, Dr. Kim says it's time to make an appointment, one that includes an X-ray of the foot.
We want to make sure that it's not something else that's causing a pain similar to neuroma.
But if it's clinically diagnosed as Mortons Neuroma, Dr. Kim will prescribe padding that will offload the metatarsal bones, causing them to spread out in the shoe. He says custom orthotics may also help.
If none of the more conservative treatments don't work, we can also try some anti-inflammatory medications, such as a clinical strength ibuprofen, or in severe cases, series of cortisone injections to really get the swelling down.
In more severe cases, an MRI is ordered to confirm the size of the neuroma, and a more invasive treatment option is used, such as surgery, to remove the neuroma. If left untreated, Dr. Kim says, in addition to permanent pain, you could cause more serious problems.
There's always a chance that that will start affecting the neurovascular bundle and the strength of the muscles around the foot as well.
As for avoiding the problem altogether, Dr. Kim says you should start with your shoes.
Always wear shoes. I know people love walking barefoot, but especially with the holiday seasons coming up, we should definitely get some type of a supportive protective gear, even inside of the house.
Dr. Kim says if that's a deal breaker, a second best option, thick socks to protect your feet.